Hello, my name is Vincent Keys, and welcome to my presentation on motivated forgetting. To start with my outline for this presentation, key components will include, in their respective order, introduction to motivated forgetting, clear definitions of key terms, discussion on the functions and effectiveness of motivated forgetting, explaining the memory system and how it is affected by motivated forgetting, the neuroscience behind motivated forgetting, experimental design providing key conclusions on motivated forgetting, and summary of motivated forgetting. So, to introduce motivated forgetting, according to the textbook, motivated forgetting encompasses the term psychogenic amnesia, meaning that the profound episodes of forgetting the events of one's life arise from psychological factors rather than biological dysfunction. Intentional forgetting has to do with the employment of conscious strategies to actively forget, such as suppression and intentional context shifts. The easiest way to avoid remembering unpleasant events is to limit encoding, and motivated forgetting is prevalent due to people being motivated to suppress unwanted memories. There will be times in which we simply cannot avoid reminders to unpleasant events. In these cases, we are left with just two choices: be reminded or stop retrieval. Since we are capable of stopping reflexive actions such as pulling our hand back from making contact with the ground during a hard fall, we may have the necessary machinery to stop retrieval. This is seen in retrieval suppression, and it is important to motivated forgetting because it can lead to improved cognitive control, which is the ability to showcase flexibility in controlling thoughts in accordance with personal goals, including the ability to stop unwanted thoughts from rising to consciousness. For some key terms, I first want to start with the think-no-think paradigm, which is a procedure designed to study the ability to volitionally suppress retrieval of a memory when confronted with reminders. This will be covered in the experimental design I plan to discuss. Repression is a psychological defense mechanism that banishes unwanted memories, ideas, and feelings into the unconscious in an effort to reduce conflict and psychic pain. Repression can be either conscious or unconscious, and it was developed by Sigmund Freud as the most well-known term related to motivated forgetting. Next, we have inhibitory control, a mechanism that enables organisms to override reflexive actions, memories, or emotions by deactivating representations or processes underlying them. Next, we have amnesic shadow, impaired recall or source recognition of events occurring before or after direct retrieval suppression, which arises from disrupted hippocampal function. Moving on to prefrontal cortex hypothesis. This is the proposal that some forms of active forgetting originate from top-down control signals mediated by the prefrontal cortex. The three-factor theory of active forgetting distinguishes three impacts of inhibitory control: memory, process, and context. Memory inhibition is the active forgetting that arises from the impact of inhibitory control acting on representations of the forgotten memory. Process inhibition refers to active forgetting arising from the impact of inhibitory control action on processes necessary to form, stabilize, or retrieve a memory. Next, with context inhibition, this is active forgetting that arises from the impact of inhibitory control acting to purge context representations used to access a memory. Next, we have selective retrieval, which is the process of retrieving a particular target memory, given a cue that is associated with various competing factors. Lastly, there's retrieval-induced forgetting, a phenomenon in which selective retrieval triggers forgetting of competing memories due to an increased tendency to forget memories that interfere with access to memories necessary for consistent retrieval. In applying key terms in motivated forgetting, I think about memory control, which is often exhibited in motivated forgetting as the collection of cognitive central processes that enable motivated forgetting. This is often exerted as a reaction to reminders that trigger the automatic retrieval of an unwanted memory or thought. There are two mechanisms that have been identified in possessing the ability to enable MC upon someone confronting an unwelcome reminder. They are direct suppression and thought suppression. The former involves the stopping or cancellation of the episodic retrieval process, initiated by the cue, and the expression of inhibitory control over the unwanted trace. Episodic retrieval is retrieval for the distinct memory type, episodic memory. This type of memory consists of long-term memory that allows for people to recall the contextual details of past experiences, such as the date and time associated with the occurrence, or even emotions that are relevant to the memory. Thought substitution involves the engagement of episodic retrieval, instead redirecting focus towards alternative memories, serving to occupy the limited focus of awareness, as well as exert inhibitory control over the memory that is sought to be avoided. Both thought substitution and direct suppression can be voluntarily deployed at any time, and both have the ability to induce forgetting of unwanted memories. This dynamic enables motivated forgetting of both neutral and effectively charged memories. It seems as though the narrative surrounding motivated forgetting is distorted, and this can be partially attributed to the previously listed mechanisms' inaccurate associations with cognitive avoidance. Cognitive avoidance is a coping strategy that involves the avoidance of processing reminders of a topic, and it is often comorbid with poor psychological memories. Motivated forgetting is more based in episodic memory, while cognitive avoidance has more to do with prospective memory, defined as the cognitive ability to perform planned actions in the future. One would think cognitive avoidance of a topic hinders prospective memory, but it turns out that blocking out certain unnecessary topics actually increases prospective memory for the tasks of primary focus. It is similar with motivated forgetting, as the intentional blocking out of harmful memories is considered a psychologically healthy process due to its utility in providing emotion regulation. Now moving on to the functions and effectiveness of motivated forgetting. Emotion regulation is defined as goal-driven monitoring, evaluating, altering, and gating of one's emotional reactions and memories about emotional experiences. Motivated forgetting is related to emotion regulation because the avoidance of unwanted memories is an active practice of emotion regulation that fosters feelings of comfort and safety in the individual. Unfortunately, the practice of motivated forgetting is not all sunshine and rainbows, as there are some notable negative side effects that could take place. These include memory distortion, contribution to development of psychological disorders, shifts in identity formation, and negative impact on interpersonal relationships. People are often unaware of the side effects associated with motivated forgetting and may not even be aware that they are engaging in motivated forgetting. It is an important distinction to note that repression is the unconscious defense mechanism blocking unwanted memories, while suppression is the conscious effort to avoid unwanted memories through inhibitory control. Suppression takes place due to multiple factors, such as the individual's emotional distress, conflict with self-image, or even as a fight or flight response to a threat. So, in a discussion on motivated forgetting, one of the most intriguing aspects within motivated forgetting is that sometimes we actually forget positive memories as well, especially if they conflict with our current goals or self-image. Self-image can be a driving factor for the active engagement of motivated forgetting, and engaging in the process becomes a dangerous game because you face the risk of losing positive core memories to continue the suppression of unwanted memories. When we engage in retrieval-induced forgetting, the act of remembering certain information can actually cause you to forget additional information that is related. Sometimes information can also be buried through adaptive forgetting, in which information that is considered to completely lack a purpose is forgotten. We are already forgetting information through unconscious repression that we have no control over, so I think it is wise to avoid an over-reliance on suppression. I understand that it is good to protect your mental health with motivated forgetting in small doses, but when you engage in it frequently, you become subjected to a damaged and distorted memory system. Motivated forgetting and the memory system. Inhibitory control supports at least two functions essential to directing behavior: selection and stopping. During selection, we must isolate one response that is appropriate for current goals from competitors fighting for control over behavior. During stopping, a single dominant response must be canceled, either because it is no longer desirable or it is inappropriate in a particular context. As various stimuli elicit reflexive actions that may need stopping, reminders can evoke unwanted memories. Selection and stopping demands take over the normal use of memory, setting occasions to inhibit memories that impede future behaviors and thoughts. These engagements of inhibitory control align memory with current behavioral and emotional goals, as patterns start to form as a result of the adapted memory system. Neuroscience of motivated forgetting. In my research, I learned Freud argued that memories could be repressed to reduce psychological conflict, and that the state of memory must often be actively tuned to suit our cognitive or emotional goals. The process leading to a tuned state of memory is driven by the lateral prefrontal cortex, specifically the right dorsolateral prefrontal cortex, or the DLPFC, which is instrumental in achieving memory inhibition. Engaging in selective retrieval of a desired memory often engages prefrontal control processes to consciously suppress competing memories. The prefrontal cortex has the capability to globally suppress hippocampal functioning, which would disrupt the encoding, retrieval, and stabilization of memories. This suppressive mechanism could include an amnesic shadow, consisting of windows of anterograde and retrograde amnesia in otherwise healthy individuals. In the midst of memory intrusions, direct suppression of unwanted memories reduces activity in the amygdala, resulting in less amplified negative emotional judgments about those events in future encounters. This serves as an excellent example in which motivated forgetting serves a positive purpose in soothing one's anxiety and depression. Now, moving on to my experimental design, I came across a study that sought to identify all studies that had used the think-no-think procedure to compare healthy groups with clinical or subclinical samples typically associated with cognitive control difficulties. The meta-analysis focuses on determining whether it is possible to foster forgetting intentionally. The study also directs interest towards whether intentional forgetting may be an indicative factor of psychological well-being. Through their search of studies, they found 25 results that entered their quantitative analysis. The authors of the article worked together in coding the entries, first focusing on recall performance for baseline and suppress items of each group, as well as 5 potential moderators of the effect. The nature of clinical or subclinical condition was also coded. In the next step, a separate author independently coded all of the information to ensure the reliability of the data extraction. In the think-no-think procedure that was meta-analyzed, the participants first learned to associate pairs of cues and targets so that they can retrieve the target upon representation of its cue. When participants enter the critical think-no-think phase, they are shown a subset of the cues, some of which are to be rehearsed by participants as recall items. For other cues, participants need to actively prevent the recall item from coming to mind, and these are suppress items. Some cues are not shown at all in this phase, and serve to assess baseline memory performance in a test phase soon to follow. That test will consist of participants being instructed to recall each response upon representation of its unique cue. The authors communicate their primary goal in the meta-analysis to determine the statistical significance and magnitude of the suppression-induced forgetting effect in healthy individuals. The authors predicted a significant SIF effect for healthy control groups, in addition to a noticeable difference between healthy control groups when compared to clinical and subclinical groups. The hypothesis includes a belief that participants would be benefited by instructions designed to induce a specific mechanism, either direct retrieval suppression or thought substitution. The latter, interestingly, has been associated with memory selection processes supported by the left ventrolateral prefrontal cortex. Evidence suggests that both mechanisms have been shown to cause forgetting. The authors also examined the emotional charge of the memories and its influence on suppression-induced forgetting, as well as effect on SIF that comes with the presence of clinical conditions such as anxiety and depression. They also looked into testing whether repetitions of suppressed cues leads to stronger SIF, and reviewed the effects of presentation time for suppressed cues. Lastly, to wrap up their 5 potential moderators of the effect, they explored whether the effect size of SIF is sensitive to the type of material that had to be suppressed. The authors performed separate analysis for each of the 5 moderators: instructions, valence, repetitions, duration, and material. In this meta-analysis, they seek to understand if preventing retrieval can cause forgetting, and if suppression is deficient in individuals with psychological disorders which are characterized by a presence of intrusive thoughts. An interesting finding in this meta-analysis is that suppression-induced forgetting was numerically greater for visual materials rather than words. In addition, healthy individuals showcased significantly greater SIF under direct retrieval suppression and thought substitution in comparison to unspecified instructions. Analysis of subclinical participants provided no evidence for suppression-induced forgetting following either direct retrieval suppression or thought substitution. The authors point out a key takeaway here in relation to the subclinical participants. If the ability to suppress memories is deficient in people who experience intrusive memories, then asking them to suppress an unwanted memory may in fact have the paradoxical effect of aggravating symptoms. They profoundly suggest that memory suppression does have a role to play as a mechanism that helps us control the intrusive process of unwanted memories being retrieved. The study concludes that the best use of motivated forgetting, specifically the conscious effort of suppression, is to maintain mental well-being. Suppression-induced forgetting can effectively be viewed as a key component of a process that results in the voluntary action of preventing memory retrieval. It can serve as a useful coping mechanism due to its dynamic that is seen among healthy individuals and subclinical participants. Preventing retrieval has its negative side effects, as does active suppression, but there is evidence suggesting that both mechanisms serve as useful coping mechanisms in maintaining mental well-being. To summarize motivated forgetting, it is the process of forgetting memories either consciously or unconsciously. Unconscious forgetting is known as repression and was developed by Sigmund Freud as he argued that memories could be repressed due to psychological conflict. Motivated forgetting comes in many forms and is often broken down into repression and suppression, the latter consisting of intentional avoidance of unwanted memories. The process of motivated forgetting indicates that our memory system can be prone to inhibitory control in order to align memory with current behavioral or emotional goals. Engaging in selective retrieval of a specific memory leads to the suppression of competing memories and can result in an amnesic shadow that impairs recall of events occurring before or after direct retrieval suppression. This is due to the lack of encoding, retrieval, and stabilization of memories when the prefrontal cortex globally suppresses hippocampal activity. Memory control consists of both direct retrieval suppression and thought substitution, and both have been proven to cause forgetting. The primary use of motivated forgetting is to maintain mental well-being, and it is important that suppression is practiced with caution due to the negative side effects that come with it. While motivated forgetting plays a key role in the emotion regulation of many individuals, it can also result in the loss of positive memories that conflict with current self-image. Forgetting does provide temporary relief, but it comes at the cost of an ineffective processing of traumatic memories, which is directly related with healing. The long-term effects of motivated forgetting need to be stated, and everybody needs to know the dangers before getting too deep down the rabbit hole. Necessary processes of healing can be interrupted by motivated forgetting, and it simply is not always beneficial to actively forget. Some of the information we forget is completely out of control, and it is easy to consider it fate, but this forgetting can be caused by active suppression and completely change who we are as a person if misused. While it is useful to protect yourself from harmful memories, understand that eventually you may need to face those memories, and the longer you wait, the more damaged and distorted your memory system may become.